Have you ever heard of a skin disease that spreads like wildfire, especially amongst children? That's impetigo. So the skin is normally covered by bacteria and fungi in their not harmful state. That's what we call normal flora. But when the skin barrier is disrupted by either scratching, insect bite, any form of trauma, scabies, then whatever it is that is on the skin seeps within and now becomes infectious because it is out of its bounds. So this is how impetigo comes about. Impetigo is a skin bacterial infection that commonly occurs in hot and humid areas, especially where there is poor hygiene and overcrowding, commonly in children, and spreads really fast by form of contact. There are two types of this disease. There is bullous impetigo and non-bullous impetigo. Bullous means that the kind of, let me say, swellings or pimples that are formed, they seem to have some fluid on the inside. Non-bullous means whatever is formed does not have fluid on the inside. The non-bullous type is the most contagious type and is commonly the most self-limiting. By self-limiting, I mean it clears on its own. So impetigo often affects the face, the extremities, which is the hands and the legs, the armpits, the trunk area, and around the anal region. So whichever one may appear in those areas. So the non-bullous type occurs in such a way that you have pimples that look like honey crusts. So they are yellowish like, and then at the bottom there's a whole lot of redness. Often it is painless, but again, the most contagious one. The bullous type, it is itchy, it is painful, there's a whole lot of scratching, and the kind of pimples that we are getting, they seem to have a fluid inside, and sometimes these vesicles normally burst to release the fluid into the surrounding area of the skin. That said, it is important that when any child is found to have impetigo, as much as it is self-limiting, given the circumstances that it spreads really fast, it is important that they are managed, which is very easily managed, so that you can curb the spread amongst the peers.